And more than 24 candidates have thrown their names into the race for the governor this year. It's shaping up to be one of the most competitive elections so far. And joining me this morning is Lieutenant Governor Dr. Josh Green, who is also running for governor. Lieutenant Governor, thank you so much for joining us this morning.
Thank you for having me. I appreciate it.
Well, you know, this is the first sweeping election that Hawaii has seen since we've emerged from the pandemic. How much of an impact do you think the last 2 years are going to have on voters' opinions?
I'm sure it's going to be very impactful. Leadership during the pandemic was critical. It was an honor to serve with so many healthcare heroes, leaders that really got us through. Hawaii was able to get through the pandemic with the lowest COVID rates and the second lowest mortality rate in the country. But the experience that we had during a crisis has shown us what's important. And as we come out of it, people are over COVID. They really want to move on. Though the virus is here and affecting some people, they want to focus on the big issues. And so having seen the crisis through their eyes, bonding with the state, I think that they are pretty comfortable with those who led us through. Now we're focusing on other things like affordable housing, the affordability of life in Hawaii, gas prices and food and all these other things. So I think it will really shift the election.
Well, you mentioned gas prices and food prices, housing prices all skyrocketing. If you were elected governor, you'd inherit the responsibility of a state where wages haven't kept up with inflation. What role does the governor have in helping Hawaii's families there?
Well, the governor has to lead by example, and the governor has to make things affordable. Putting in place a livable wage is critical. That is absolutely something that had to happen, and I'm glad it did happen this last legislative session. But the governor has to own the challenges that our families went through. There were a lot of people that were housing unstable. It's because we don't have enough housing. We need a moonshot on housing, and that is going to be my signature focus, making sure we have housing for all of our people so our kids don't leave the islands or don't need to leave. Also, we should get rid of the tax on food and medicine. I've been calling for that for years. It will impact our finances slightly. It would mean $120 million less of tax revenue, but those taxes should stay in the pockets of working families because it's just so tough with inflation as we've seen. Gas prices will come down once the war in the Ukraine goes away, and it will go away eventually. But these are things that I'm focused on every day and every night. And really, we were traumatized as a society because of COVID, but now that we get back to our regular lives, some of those other challenges are still there that we need to address.
You mentioned the homeless issue here in Hawaii. We did have a call this morning from Susan, a loyal viewer, and she wants to know, what can a governor do to help get homeless families off the street and into housing?
Well, I think this is our largest moral challenge in the state. Affordable housing for working families is different than addressing homelessness, although they do touch one another. What we've done, my team has done, is we focused on building kauhale. We built 2 villages to help those who are chronically homeless. About 1% of our population, 15,000 people every year, avail themselves of some services for homeless needs. But there are others, about 3,000 people, who are really in a devastated state. They've got PTSD, they probably have addiction, they have mental illness. Those individuals, because this is a health consideration for them, need social workers, psychologists, psychiatrists, and then they need to be put into a tiny home. It's very affordable. We did partnerships with the private sector and it has worked. We'll never turn our back on other things, just like building very low-cost housing, doing some of the social programs like shelters. Those are all very important, but I'd like to build at least 10 additional kauhale for those who are in greatest need.
This past week, the field of candidates changed rapidly. Former Mayor Caldwell dropped out of the race, and now Representative Kaikahele has jumped in. How does this change your campaign?
Not one lick. I really wish former Mayor Caldwell well and his family. I wish the best for Kai, but I will tell you this. I'm focused day in and day out, number one, of rebuilding our state after the pandemic, which is going well. My team built the Safe Travels program with other leaders, and that brought our economy back, really roaring back. And when the Japanese community comes back, it's going to even be supercharged more. But beyond that, I'm focused on housing. I'm focused on the needs of our people. I'm focused on bringing mental health care services back to people. Whether it was Mr. Caldwell or Mr. Kahele, that doesn't change our needs, and that doesn't change my family's focus or my focus.
We spoke to Representative Kaikahele on Monday about some of the criticisms of his absence in Washington, D.C. He called those pilau politics. Do you think it's fair to assess his attendance in Congress?
I really am not interested in addressing any of my opponents' criticisms or concerns. I really just want to stay positive, bring our people together. I will say this, you have to go to work on behalf of the people, and that's what the governor, our next governor, has to do. They have to be someone that goes there 7 days a week, 24/7. That's what I think people have learned about me. I will work day and night to make sure we have what we need for our people. But I really don't think things should be contentious. I think we should spend our energy focusing on the larger challenges that we have. Everyone knows affordable housing is number one. Everyone knows homelessness has to be addressed. And then there are these other key issues like education, to support our teachers better. But if we can't have housing or enough affordable housing, we can't attract teachers. We're 1,200 teachers short every year. If we don't have housing, we can't afford to have our nurses here to take care of our kupuna. Instead of people getting all political about things, I think we should focus on these key issues, because after the pandemic, which was something we really all wrestled with together, and I'm so proud of our people for fighting through this together, the last thing we need is divisive politics. What we need is solutions.
You mentioned education. We had a story this morning where teachers are now being trained on how they can better accommodate students who might have missed out on educational opportunities during the pandemic. What can the state do to help support efforts to get students and teachers caught back up?
Well, the program I will propose is called Primary Promise. And Primary Promise is a program that's worked out of California. It's been proven to show great results for kids. For the children that have challenges with literacy in the early years, ages 6, 7, 8, 9, by putting a second teacher into the classroom, and not just an aide, but a second teacher, that would mean about 200 extra educators in our state, about $20 million, you will see kids catch up within 6 to 12 months. It's extraordinary to do that kind of thing. So my education program, which I'll go into great detail in the coming months, will be a program that goes from age 3, pre-K for all, up through 20. That means good public school education. I was a public school kid all the way. And then also some community college on the back end if people would like it. So age 3 to 20, that's how you get there. There is going to be some catch up. Sammy, my son, he's 11, he's in a great public school, charter school, but it was very difficult. They only had a couple half days a week, and so we had to educate him at home, and Jamie did an extraordinary job with that. But not every family was lucky enough to be able to educate their kids because they had to work.
It's been widely publicized that you are an emergency room physician. You've been in the emergency room during this pandemic, treating COVID patients. If you accept the position as governor, if you're voted as elected as governor, will you continue to be an emergency room doctor? And how will that play a role in your performance?
I should be very clear about this. No, if I'm elected governor, it's 24/7, 365 for me, just like really it's been for me as lieutenant governor. On the weekends, 2 weekends a month, I was an ER doc on Big Island, which people needed me there during the pandemic. First of all, by law, the governor can't have a second job, and also just my heart is to be governor full-time. But I will tell you this, I still will be a physician. I intend to volunteer at our homeless clinics and do street medicine. I know it does cause some concern for people because they see me doing wound care on the streets and they wonder what the heck could a governor or lieutenant governor be doing. But it's a way for me to be deeply connected to people who are in need. So I will do medical missions, which is what I did before I came to Hawaii. I was a medical mission doctor also in South Africa and Swaziland and other places like India. So that's what I intend to do and lead medical missions. But as a physician, I will be a physician governor if people are generous enough to choose me.
Let me ask you one more question here on a personal note. Like many others in Hawaii, you have 2 jobs. Which do you prefer? Do you like being a doctor or do you like politics better?
I prefer being a dad better than either of those things, honestly. I have loved being lieutenant governor. It's given me the opportunity to get us through the largest crisis we've ever faced with other terrific leaders. That has been a great honor. Being a doctor has been actually my place of respite to go and care for individuals that actually caught COVID or who were dealing with the effects of isolation. Both jobs were an honor. If I'm chosen as governor, like I said, I'll do medical missions as a volunteer, but be a full-time governor. If I'm not chosen, I'll be a full-time physician. So either option is really a great pleasure. I came to Hawaii with the National Health Corps. I ended up as lieutenant governor and possibly as your next governor. And I just want to thank everybody. People have talked about how much support we're getting. Well, it is an honor to be supported by teachers and nurses and people who build our houses. Those are very humbling moments to have that kind of support. So thank you for that.
Lieutenant Governor Dr. Josh Green throwing his hat into the ring for race for governor here in the state of Hawaii. And we'll have more of the candidates throughout the weeks coming up to the elections here in August and November. Thank you so much, Dr. Green, for joining us this morning.